If your student sustains a vertebral compression fracture in your class, you'll feel pretty for quite a while. Now, the difficulty is that a lot of fractures happen in those kinds of moments, a coughing fit while bending forward, tying your shoes. And in fact, a lot of vertebral compression fractures happen in bed at night. So we can't stop all of them. And when the research shows, or at least some small studies have indicated that yoga can or may be part of the reason someone sustains a vertebral compression fracture, we have to do our best in the class, of course, to reduce the likelihood within the class. But there are other things that we can do to perhaps reduce the likelihood in bed, etc., like, for example, building back strength. So all is not lost, but it's a very difficult diagnosis. And we as teachers can't keep everyone definitely safe. But if your student sustains a vertebral compression fracture in your class, you'll feel pretty for quite a while. But if they sustain a vertebral compression fracture within the time frame of them happening to come to your class once a week, this does not mean that it is your fault, because we can't be sure when it happens. Mostly, there isn't intense pain with a vertebral compression fracture. It can happen slowly, it can happen suddenly. For some people, it's immediately very painful. For some people, the pain builds, and we'll talk about how you can recognize if you have a VCF at a later point.